Welcome back to Facial Aesthetics Unmasked. We are Utah Facial Plastics. I'm Dr. Thompson.
I'm Dr. Henstrom.
I'm Dr. Manning.
So last time we were together, we talked about donor hair in hair transplant procedures, where it comes from, how do we decide what to use. Today we're going to talk about what goes in to planning a hair transplant procedure and how do we go about doing that so that we have the best outcomes for patients. So Dr. Thompson, I'll ask you, when you're looking at a patient and you're seeing somebody, how do you decide how much hair you're going to plan on using or needing for this transplant procedure?
Yeah, so like Dr. Henstrom said, last time it was the donor area, which is the back of the head. The recipient area is typically up on the top. It could be in the crown, it could be just the temples, it could be the hairline. There are all sorts of areas where people will thin, and it could be male or female. We do all of those procedures here. And one of the first things we have to decide is how many grafts are we going to take from the back, whether it's a strip or an FUE, as we talked about before. And for me, there's a few things that go into that decision. The number one thing that goes into the decision is, what is the concern of the patient? Are they concerned that their hairline is receding or that they have a high hairline? Are they concerned that just the area of the crown is thinning? And so, I may see something very different than what they see. So it's very important that I understand and am communicated with, and I communicate with the patient about what is the primary area of concern. And so once I know that, then I can have a better idea of the number of grafts. It could be anywhere from 500 to 3,000. So there's a wide range, and that all depends on, the patient's concerns, but then also their age and where areas are thinning. So what are the common areas that we're transplanting to, Dr. Manning?
Well, like you were saying, it's really the area of the patient's concern. I feel like for men, a lot of times you're receding here and that you're kind of getting the two-car garage thing going on. And so a lot of men are wanting to bring those forward and to kind of soften the hairline in the front, or rather to keep those from being quite so deep. And obviously then with male pattern baldness, you're going to be getting not only the recession here in the front corners, but also in the crown of the scalp. For women, the pattern is a little bit different most of the time. The pattern is a little bit more diffuse, a little more spread out. You tend to lose less hairline, but you lose the hair behind the hairline and kind of in a generalized pattern over the top of the scalp. So
Decreased density.
Decreased density. Mm-hmm. Yeah.
When you guys are counseling patients, I've had a number of patients come in with their own certain number in mind, and we see this advertised a lot where patients may go to other countries and think that they can get procedures that are 4,000, 5,000, 6,000 grafts at a setting. Why don't you just comment a little bit about that, Dr. Thompson?
Yeah, so yes, things can be promised and you can see results online that may or may not be accurate. 4,000 grafts in one session or 5,000 grafts is actually pretty unrealistic to be able to keep the patient comfortable, to be able to harvest that much hair without leaving a problem on the back of the head, and to be actually able to do a good job. It takes a long time to place a single graft and to do the job well. It takes a long time to make all those sites accurately and precisely. And so the higher the number is, I would say the more chance there is for maybe a little bit of sloppiness or maybe a lot of patient discomfort. And so for us, 3,000 is about the maximum that we like to do. And that's a full day endeavor for a patient. And we can guarantee you're getting 3,000 grafts. If somebody promises you 4,500, I would be skeptical that you can do that in one session and be comfortable and be able to be confident in the result.
And this is with the FUE method, correct, that you're primarily referring to?
With either method. I think 4,000 grafts for a strip is also very unrealistic because you're going to end up with a large defect that's difficult to close and likely a kind of an unsightly scar.
Right.
I've actually seen people who've been over-harvested in these, they've tried to go for a large session, and what that ends up looking like is, at least what I've seen, is they start to harvest beyond where people are going to recede in the back. And so what you end up doing is getting grafts that are going to fall out sooner because they're they're programmed to fall out. They don't lose their identity when you move them from here to the front of the scalp. And then it makes that area even thinner when you do thin. And so as time goes on. So I think that's one of the things that doesn't really get discussed when you're talking about these really high numbers. It's everything that you were saying, and then you're going to continue to recede into those areas where you're taking the grafts from, and it's going to cause you problems down the line.
Yeah, and even not just the long-term increased rates of loss, but the short-term rate of loss is going to be higher in the immediate post-operative period, with a higher percentage of those grafts just not surviving because, they've either been out of the body too long.
They've been transected.
It hasn't been doing well. So there's a lot of things that can happen to a hair follicle that can cause it to not survive. Now, one thing you should know is that if we talk about 3,000 hair follicles being transferred, that could equate to anywhere from 4,000 to 500 individual hairs, because in each follicle you can have 1, 2, 3, or even 4 hairs growing out of a follicle. So you'll have more hairs transplanted than follicles, and that can help increase the density.
And that could potentially be part of the reason somebody's promising 4,000 or 5,000. Maybe they're talking about hairs, not follicles. And so those are important distinctions. One thing I was just going to ask you is, when we talked about the numbers of grafts we're transplanting, how does the age of the patient come into play with sort of determining, maybe how many you're going to do and where you're going to place those?
Yeah, well, first of all, we see patients with a very wide age range, right? We'll see, especially young men that start aging and getting hair loss at a very early age. We'll see them early on, but we won't necessarily consider them good transplant patients. We've got to go through that medical management that we talked about earlier, see if we can get them to a place where they're not losing hair. So their hair pattern loss early on might be very different than the diffused hair loss of a 60-year-old, where it's plateaued, they're not losing hair anymore, but it's diffusely gone. That also is going to make a difference in how much they've lost on that crown. And like Dr. Manning referred to in our earlier podcast, how much area do we have on the back of the head for the donor area? How much hair can we actually get out of the donor area to transfer, and then making the decision of where are we going to transfer that? Where's our priorities going to be on this person's scalp? Is it going to be in the front, in the temporal area, in that frontal hairline, helping to frame the face? Is it going to be mainly just back on the crown, because that's what they're most concerned about? As we age, those hairs are also not going to be quite as healthy and quite as strong. Will they transfer as well? But it's interesting because we've all had older patients, and some of them have had previous procedures. They've done well with that, and so we're doing their second, third, even fourth procedure, and those hairs can do well, but it does come down to how much hair do they have to give, and then where are we going to prioritize? So, Dr. Manning, I was going to ask you about this. Procedures, repeat procedures, like I was just mentioning, and your feeling on doing secondary and third, tertiary procedures on patients and how that turns out.
Yeah, and I think that we have very good success on secondary or tertiary procedures on our patients. It's always better to get as many as you need the first time around if possible, because anytime you go back with either method, there's a little bit of scarring that occurs on the skin. And in the case of FUE, what that does is you take out the individual follicular units, the area next to it might change direction just a little bit. So the next time you come back to harvest, the hairs are kind of tilted in a way that makes them a little bit harder to remove from the scalp. With an FUT, that strip coming out can make the scalp a little bit tighter. And so when you're coming back the second time, you just want to make sure that it's not too tight to where you can't get that incision to close really well. But it can be done, and we do it all the time. The key is to do a lot of them and to be very realistic with what you can expect from the procedure and the numbers you can expect, and to be very cautious in the way that you take those donor hairs out to make sure that you don't cause further problems.
I got one more question for you, Dr. Thompson. Some people have a misunderstanding of what the strip means and how we use that to transfer hair follicles up to the top of the head. Can you just address what that means?
Yeah, and again, like we talked about on our last episode, the strip sort of doesn't get a lot of attention online, and it's a great technique. It's an excellent technique. It's still a gold standard, and I'd say, at least for me, and probably the same for my partners, it's about 50% of each procedure that we do. And it comes down to which procedure you're a good candidate for. And that's something that we can discuss and help with. But I think sometimes people have the idea that if we do this strip procedure, we're going to take this strip of hair and then somehow just place that up on the top. And yes, that would be terrible. It would look awful and it would look unnatural. But no, what we do is we take that strip of hair, and then we have a team of hair technicians who are very experienced at this. They'll take that strip and they'll divide it into individual follicles. And so the final result is the same with whichever harvest technique we use, whether we're taking them out one at a time or whether we're removing a strip. Sometimes people are really kind of, I guess, optimistic or aggressive about how they want to design the hairline. Maybe they want to fill things in, bring it way down, or fill things in, or devote all the hair to the crown when they're still really young. It's our job to help you sort of plan for the future when we decide what to do. We want this to look natural for your lifetime. And so sometimes we have to sort of reframe the conversation a little bit and decide, you know what, let's not bring the hairline down quite that much. Let's be a little bit more conservative so we can plan for the future. And, you know, that's our job, is to help you have a natural result and to have things, you know, what they are, what's going to be the most ideal long term.
That wraps up this episode. Thank you for joining us on Facial Aesthetics Unmasked.